So our flow to day one, we'll give you an example of day one, but here's how day one goes. They're going to be greeted at the front desk. They're going to come in, they're going to fill out any paperwork if they haven't. Most of our people already have filled out their paperwork, they've submitted it online. They're going to come in, they're going to get a warm, friendly welcome, probably ask if they want any water, and they're going to be brought back to our consult room. The doctor, I'm not going to go in there immediately. The first thing that's going to happen is Tanya, our front desk CA, well, she's not our front desk CA, she's our back end CA now. She's going to walk through the door, she's going to introduce herself, and she's going to go through that consult. The questions that are bottom, that's pinned at the bottom of this thing, she's going to go through them. And maybe not all of them, but she's going to get the gist of the problem. She's going to connect with them. She's going to get all that. She's going to get any what we call doubling down. If they have any extra problems, we want to make sure that we create ourselves even more valuable in the patient's mind, because they might not be thinking about their headaches, they're just thinking about their low back, or they're not thinking about their GI. But we're going to introduce them. We're going to start educating them on day one. We're going to start just maybe putting little deposits in their mind to let them know that chiropractic is more than just bad backs and neck pain. Once she gets all that consult, she's going to go through that. She's going to bring them back, and she's going to do whatever scanning measure that she does. We're going to have something for the doctor to already have looked at to establish whether or not we feel like we can help them or not. So that goes a little bit different than what most people do. Most of the time the doctor does that, and then we come back for a report of findings. But we want to go ahead and have some kind of scanning tool that they can do, whether that's EMG, thermography, if girls are trained, maybe an x-ray. And what our girls do is, or Tanya's going to do, she's going to bring them back. She's going to x-ray the area of complaint. If it's both areas, then she'll get approval and she'll do both areas. And as soon as she gets that, she's going to print it. She's going to leave the patient in the exam room, and she's going to come back to me, and she's going to show me those x-rays. She's going to give me the consult. So usually I'm adjusting, and she'll just kind of motion to me that we have a new patient that's ready to be examined. I'll come out, I'll go through the films, I'll go through the consult. She's going to brief me on that person, and then she is going to bring me back to the exam room, and we're going to do an introduction. And at that point, we're going to introduce myself. I'm going to go back through that consult, make sure that they're understood, and then I'm going to go through their x-rays. I'm going to show them hopefully what's exactly going on, or what we have an idea of what's going on. I'm going to do a little bit of education with them. That aha moment, we created some distance already between me and that patient. And at the same time, we're going to do some education. We're going to get some questions. If they have any questions, and then we're going to ask if it's okay for us to examine them. So, hey, let's check you out. Let's see what's going on with your neck. And at that point, we'll do our orthopedic exam. Mine's really just a palpation. I'm looking for subluxation. This is straight base, chiropractic practice. So we're looking for segments that are no longer functioning, moving. We're looking for nerves that are being inhibited. So we're going to go through their joint. We're going to check them from there, usually from the occiput all the way down. That's where a full spine practice. At that point, I'll mark, I'll call it out. I'll say, hey, C1, left side. I'll make my listing calls. And then once we get done, we'll set the patient back up, and I'll send them out for more exams. So what I mean is it's all in-house in ours, but we'll say, Tanya, what I need is a thermography on it. I want to see where there's inflammation. I will want to get an EMG also on this person. We want to see balance, symmetry. We want to see if those nerves are being inhibited. So we gather all that information, and then we've got you scheduled back tomorrow at 4:15. We're going to have looked at that. They're going to have their x-rays already in hand. So that's a great educational tool that they can take back to their wife and show them what's going on. At the same time, we're going to gather those other two, and that's why we need time to process. We want to look at all the picture all together, and then we invite them back in for their day two. So after I get done, I'm done. That's it. It's literally 5 minutes. I usually kind of confirm what she found on the consult. I do a little bit of education on their films, because we take motion x-rays. You want to see, hey, this is where it's moving, or you got some degeneration. This is why you have numbness and tingling in your hand. We do the exam, we confirm those findings, and then at that point, we step away. She does the rest of the exam, the rest of the scans, the stuff that she can do, and then they come back the next day. I have the thermal, I reprint their x-rays again, I reprint their scans, and then usually we educate, we do more education, we show them, we do a report of findings, we give them a recommendation for care, and that's it. It's short and simple. Your day one doesn't have to be super complicated. It's not salesy, it's just facts, uncovering what's going on with that person, and establish whether we can help them or not. And if you take that approach and you're not doing all the salesy front end, you're not trying to connect with them as a friend and do all that extra stuff, It just makes a world of difference. You don't see any orthopedic surgeons trying to become friends with their patients or educate them all about orthopedic surgery. They're there to just show them what's going on with their shoulder, their rotator cuff, if that's what they're getting operated on, and that's it. And so we just need to establish what's going on with them, whether or not we can help them, and then what is it going to take to get their issue resolved. And that is the purpose of Day One. If you stick to that, it's a game changer. You're going to win. You're going to have lots of prepays and pay in fulls, and just it's going to work out for you. The longer you're in your consults, the more you talk and open your mouth, the more opportunity there is for just disconnect, in my opinion. So set yourself up as an expert, and we'll see you on the other side of the video at our Day One.